Welcome to One-on-One. I'm Steve Adubato. Let me introduce for the first time Richard Stagliano, who is president and CEO of Center for Family Services. I just found out that his family, now my family originally from Italy is from Naples. Yours is from Calabria?
Yes.
And the other combination is?
Sicilian.
Now, Sicilian. Is Sicily still a part of Italy?
Oh, yeah.
I'm joking.
Okay. Yes.
There has not been a succession movement there, but we're here to talk about this country and a particular issue in our country, which is a crisis. The opioid abuse crisis, connected to what you're doing at Center for Family Services, because it is making a big difference.
Yes. Well, let me tell you a little bit about the Center for Family Services, first of all. So we are a multi-service family service organization, and we run more than 70 programs to help children to deal with children and families to deal with the challenges that they face. So we do everything from family support programs, domestic violence, sexual assault, behavioral health, early Head Start programs. We're doing everything to help change the odds for disadvantaged children and their families, and also help people that are challenged. We all have challenges in our life. Sometimes family and friends can help, but sometimes we need professional help, so that's where we come in.
So the opioid abuse crisis, if you will.
Yeah.
Someone says, well, you got to treat that particular patient and take care of that patient. You say, yes, but it's more than that.
It's more than that, and it's, we're a supporter of families, and how do we help families to deal with these issues? What do they need? They need a lot of support, they need a lot of education, and they need a lot of direction and help. You know, people, it's amazing, is all the resources in the community, and it's not always enough, but still people don't know where to turn sometimes, and so it presents a real challenge for them. So just being able to walk with people, help them find their way, is critical to supporting them as they're dealing with someone who's facing a major crisis.
Let's go through some of the programs. You got peer counseling.
Yes, we do.
What does that look like?
So the addiction field has changed dramatically in recent years. You know, 30, 40 years ago when I started in this business in general, there was not a lot of support and understanding that people can recover from addictions, people can get better from mental health issues, and I think the world has changed and people are starting to recognize that treatment does work. So we've been working on we have a recovery center that we've been doing, first of all, drug abuse treatment for more than 40 years. And so we have intensive outpatient programs and outpatient programs. But the important thing is to have access to treatment and to help people. You know, one of the symptoms of the disease is denial, of course. People don't realize they have the issue. So we have a recovery center we opened 10 years ago, and a lot of the work done in the recovery center is with peer recovery coaches and peer specialists who really can talk the talk and really walk with the people that need help.
The other part of this, sorry for interrupting, children.
Yeah.
What do children need in this?
Well, children, of course, are affected by families where there's addiction issues. So, and when we know that children will potentially develop other problems, and so they need a lot of support and help as we strengthen their ability to cope and deal with the issues.
How'd you get into this?
So, I've been interested in mental health, substance abuse, family support, and social justice issues that everybody needs help. And I've been at this organization for 37 years. When I first started, we were a staff of about 20 people with 2 programs. We're now over 1,000 employees and 70 programs, and we're really making a difference. And that's one thing I'm proud of, that I've seen so many positive changes, that people accept what we do now. They trust the mental health community more than they ever did, and the substance abuse community. And we've just started a great new program with recovery coaches.
Yeah, that's a recovery program started in September.
It's just started.
18.
Yeah.
So it's recovery coaches helping whom?
They are helping, well, first of all, in the past 2 years, since this opioid crisis has really boomed and so many deaths, we now have, we've received money from the state of New Jersey, Department of Health, Division of Mental Health and Addiction Services.
So all the money comes from the public side?
On the one hand, we have some public money that helps us to respond, with this new medication, and there's Narcan that helps people who have overdosed. They can, we're in 6 hospitals now. We have recovery specialists who meet the person after they're brought back from death and try to help them think about treatment and get into treatment, and they'll follow them around how can we break down the barrier to get you some help. So,
Richard, the other part is we heard about you from some folks over at the Horizon Foundation.
Yes.
What's the connection there?
So we have just received another grant from the Commission on National and Community Service, And so we started a new program called Recovery Corps.
Recovery Corps.
Yes, where it's like the Peace Corps in the AmeriCorps program here in the United States, where people can volunteer. So we're going to take people in recovery, we're going to give them a stipend, we're going to train them, and they're going to become peer specialists. We're going to train 20 people over the course of the next year, and we'll respond to over 600 people who are in need of help. So these are recovering people themselves who are going to go out and be mentors and coaches to people that are trying to, get clean and recover from addiction.
And the Horizon Connection is their...
Horizon is providing the staff support money for us, because we cannot do it without, we got money for the peer counselors and money to...
Man, you got to raise money. Just like us in public broadcasting, we're raising money all the time.
It's true.
Not all the time. The other time we're trying to do what we do.
Everybody who, yes.
You ever hear the expression, no money, no mission?
Yes.
It's true.
It's true. People don't understand that. In the nonprofit world, you still need money. You're running a business, and you need dollars. So Horizon came up big for us because we couldn't do the program without them.
Before I let you go, there's a merger taking place with whom?
Yeah, we're merging with Family Service Association of Atlantic County. We're down in southern New Jersey, so we're going to strengthen both organizations and expand our ability.
How does it help the people you help?
Well, we're more efficient. We can better use our dollars. We can compete better. We can generate more dollars, as you know, as you do in the private sector, from foundations and donors, as well as the public sector. So
we got to partner, got to collaborate in the not-for-profit world.
Yes, we do, and this with Horizon and with the state and with the recovery, it's a win-win-win for the people that we're helping.
Richard Stagliano.
Okay.
Philadelphia, you got this Philadelphia connection?
Yes, I do. Yeah, sure. Lots of family from Philadelphia.
Absolutely. President and CEO, Center for Family Services. I want to thank you for joining us.
Thanks so much.
Well done. Stay with us. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey, NJIT, RWJ Barnabas Health, the New Jersey Education Association, Valley Bank, and by New Jersey Resources. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.